Welcome back. When arthritis damages our hips or knee joints, it can cause chronic pain and limit daily function, certainly affecting really our quality of life.
Absolutely. Well, joining us today is Dr. David Heekin of the Heekin Clinic, and Dr. Heekin is going to explain how joint replacement can restore people to active, functional, and fulfilling lives. Thanks so much for being here
once again. Thank you.
We want to start with a really interesting statistic. A recent study nationwide showed that 7.2 million Americans are living with hip or knee replacements. Did that number surprise you?
Well, not really. If you figure out the demographics of it, and people are living to be older, and the number of total joint replacements is going up in the country, it makes sense when you put those two facts together. And as the graph schematically shows, that the number of hip and knee replacements that people are experiencing now in this country has increased multiply.
So what do you attribute this increase to? Are we just kind of outliving our joints,
our
or
parts
what's happening?
Yeah, we're getting older than our
certainly
parts.
that's one thing. I mean, we're an aging population, and so as we age, and the demographics require that more people would need hip replacements and knee replacements, but also the part of the population that's aging, the baby boomers, have been very active, more active than previous generations, and so they're living with the joints that are now becoming arthritic due to sports injuries that they've experienced years ago.
So you mentioned that as the population matures, obviously people are traveling more, they're more active today. You know, they always say what the new 70 is the new 50, if you will. So how can these replacements help them to maintain that healthier lifestyle, particularly if this is an elective surgery?
Well, you know, 50 years ago, people with hip and knee arthritis told them to sit in a chair and take aspirin until they died. But
walk
now,
with a cane.
Yeah, of course. But now the technology has improved so much that we are able to replace a joint with relative ease, and then it gets rid of the arthritis pain forever. You can never have arthritis in a joint that's been replaced, and you get up and go, and it functions like a normal joint.
So if someone's watching right now and they might be thinking that they're to the point of needing a joint replacement, or at least seeing someone such as yourself to discuss this, what do you recommend that they do? At what point should they make that appointment, I guess?
Well, I think the first thing to do is to be sure of the diagnosis. Is it arthritis, or is it something else? And the primary care doctor is the first avenue to approach, and take an x-ray, do a physical exam, and then maybe if it's early arthritis, try some conservative measures, anti-inflammatory medications. If you can tolerate those, using ambulatory support like a cane. Change your activities. If you're impact loading like running, try something else that's non-impact loading, and maybe continue to stay in cardiac shape. But when those things fail, and at some point they will, because arthritis is a degenerative process, then it's time to think about going to see the orthopedist.
And we've got a lot of joints in our bodies. So do you see that there's one replacement surgery that you have a higher success rate than others? Well,
you know, the non-weight bearing joints, shoulders and elbows and wrists and that, really don't bother people as much. They're an annoyance, but not a limitation. But the weight bearing joints, you know, the hips and knees primarily, are really those that when they become arthritic, they limit our activities. We tend to sit more than we walk, and we tend to lose the cardiovascular tone. So those are the ones that we replace more often, and they're also more successful.
And I should say congratulations is in order. You guys recently opened up a new clinic. Tell us about that, where it's located, and how can people get more information?
Yes, we did. And so I broke away from the practice that I founded 15 years ago and formed my own smaller practice, and it's a solo practice, and it's really allows me to focus on what I love, which is joint replacement. And I do more of those than anybody in Florida, and I think we at St. Vincent's do a real good job of that, and we'll continue to do that.
Where can people find you? Where is the new location?
I'm over in the DePaul building, which is attached to St. Vincent's Hospital, and I think the address will show up on the TV.
Yeah, right on the bottom.
But it's in the DePaul building on the 6th floor. It's a beautiful office, and it overlooks the cityscape, and it's very nice.
That's great.
All right. Well, thank you so much for
joining us.
Good seeing
you once again.
Thank
you
you
for being here. Congratulations,
thank
too.
you.
And we'd like to thank the Heekin Clinic for sponsoring this segment. For more information or to make an appointment with Dr. Heekin, you can visit their website, which is on your screen, but it's www.heekinclinic.com, or you can call their office for more information, and that number is 904-328-5979.